Now, I want to talk about a relationship between two important things in gynecology, and this is us trying to establish the relationship between contraceptives and pelvic inflammatory disease. So, in trying to establish this, you are trying to say, can contraceptives cause pelvic inflammatory disease, or can you use them on a patient that has pelvic inflammatory disease, or are they not compatible? Do you understand? So that's just the relationship we are trying to establish. So contraceptive methods, funny enough, they can influence the risk. Okay, they can even exaggerate the symptoms, or they can also affect if you want to manage pelvic inflammatory disease. Okay, so intrauterine devices, now let's talk about them as related to this. We are first of all talking about the intrauterine device, that's a copper T. Okay, they have been associated with a slightly increased risk of pelvic inflammatory disease just some few days after you inserted it. So risk window is highest within the first 20 days post insertion. It then returns to the baseline. Prevention strategy is you screen the woman for sexually transmitted infections before you insert any intrauterine device, because you want to actually reduce the risk. Okay. Then oral contraceptives may reduce pelvic inflammatory disease. Do you understand? Do you see how they are alternating? So they reduce it by thickening the cervical mucus, which can hinder the bacteria from going up, from flowing properly. Barrier methods, highly protective against that's like condoms. They are protective against pelvic inflammatory disease because they prevent those sexually transmitted infections from getting in. Do you understand? So injectables and implantable hormonal contraceptives, they are similar to the oral. They thicken cervical mucus. Do you understand? So it will reduce the risk of pelvic inflammatory disease. So the only one that was kind of like promoting pelvic inflammatory disease was the intrauterine devices. Those are the copper T.